I'm now going into my patient's room. At this point, I would wash my hands, and then I would do an environmental check. Hi there, my name is Kate. I'm a nursing student from Durham College, and I'm here to give you your 9 o'clock enoxaparin injection. Is that okay? Yes? Okay. Could you tell me your name, please? Sid Garland. Sid Garland. And your date of birth? 11/08/1965. 11/08/1965. Do you have any allergies? Yes, penicillin and codeine. Okay, penicillin and codeine. And what type of reaction did you have? A rash? A rash. Okay. So I'm going to be giving the injection in the abdomen, about 2 inches away from the umbilicus. First, I will observe the site for any bruising or lesions, and then I'll palpate the area for any tenderness or nodules. So I'm just going to take a look at your abdomen here, okay? You having any pain? No? Okay. So based on my assessment, I am noting some bruising up in the right upper quadrant. So I'm going to be giving this injection in the left upper quadrant. At this point, I would put on my gloves. And I'm going to use this alcohol swab, and I'm going to cleanse the area. So I'm going to do it in a circular motion. Okay, and I'm going to give it about 10 to 15 seconds to dry. And okay. At this point, I'm going to pinch about 2 inches of skin and inject the needle at 90 degrees. So I'm going to pinch, inject at 90 degrees, maintaining my pinch. At this point, I would slowly inject the medication at 10 seconds per mil. So because I'm giving 0.75, I will be injecting for around 10 seconds. So I'm going to now withdraw the needle, and I'm going to release the skin upon withdrawing the needle. Now I'm going to put the safety on my needle. And with the alcohol swab, I am going to put it on the site. I would not massage the site, just a bit of minimal pressure. Okay, dispose of that. I would now cover up my patient here. At this point, I would take my syringe and I would put it into my sharps container, which I have done, and I would remove my gloves. And I would dispose of those. So the health teachings for enoxaparin would be to advise Mr. Garland to report any type of bruising or bleeding that he notices immediately to the nurse, and to limit any alcohol as it may increase the risk of stomach bleeding. For the post-assessment, I would return back to assess my patient after the onset. Enoxaparin, the onset is unknown, so I would go back within 10 to 15 minutes and assess the injection site, looking for any redness or swelling. I would also ask him how he's feeling and remind him to report any bruising or bleeding that he notices. At this point, I would go my room and I would document on my MAR. So the date at the top, my initials at 9 o'clock, enoxaparin, and then I'm going to put a line for my co-signer, and then the site is the left upper quadrant.